Hey, Christine. Good morning. Hey, can you hear me? Oh, I don't hear you yet.
Okay. You hear me okay?
Wondering if I did something. Oh, here. Try that. Can you hear
me okay?
Yeah.
Yeah. Awesome.
Funny. I have my earbuds in, but I didn't pair them to my computer, so they're doing nothing.
Oh.
That's hysterical.
I'm getting ready to make the kids some macaroni and cheese, so I was basically going to come on here just to hear what you were talking about.
Yeah, totally. No, and I'm fine with that. I'm going to give it a couple more minutes in case somebody's coming, somebody else wants to join. But yeah, no, fully ignore me because I do that all the time. Like, listen, but ignore me. You know what I mean? I'm not offended. I'm going to pair my earbuds if I can. No, they're not.
I appreciate you doing this.
Oh, you're sweet. Well, hopefully, I don't know if it'll be helpful or not. But good night. Yeah, I don't know. Hopefully it'll be helpful.
Yeah, I think it will. I think just for me, just trying to find the right place to find all the information is seems like it's everywhere, and everyone has their kind of opinions about what to do, and
totally.
So it's like, ugh.
Well, and it's hard because there's a lot of information, but there's a lot of misinformation. There's a lot that we just don't know, which, you know, yeah. You know what I'm going to do? Since we don't have anybody else, I'm going to grab my, I printed off a study and I think I left it in my kitchen. I'm going to go grab that. And then I'll just start talking like there's 15 million of us and it'll just be at you.
Okay, good.
Okay. Okay, I'm just gonna get started and I'm just gonna record it so then everybody can watch.
Yeah, I'm gonna go ahead and I'll mute myself and then Perfect. I'll come on so
if
I don't.
You have questions, yeah, for sure. Okay, guys, we don't have a ton of people that are joining us, but it's Saturday morning, and I don't blame everybody. It was late, what is that? Notice. But so here, I decided that I would offer to come on and help, just to help share information that I know, what we don't know, those type of things, because I think there's a lot of fear going on. There's a lot of misinformation. There's a lot of just unknowns when it comes to this COVID-19. So let me give you my stats. I am a family physician. I have been practicing in Colorado now for 12 years. So I've been around a while, not through SARS. I actually wasn't in medicine during SARS. I was during Ebola. So those type of different things. Family physician, I've been doing outside family medicine for about 9 years. 3 years I did just eating disorder stuff. So I've been in and out of it. Right now I am considered the front lines. We have been doing testing for COVID-19 in my clinic. In the next week or two, my clinic's actually doing a specific clinic. So we're going to send anybody who's sick to one centralized location. And I will likely be someone who helps out with that in April. They're just going to have nobody gets to come to our clinics. In fact, our clinic just shut down to anything that's not an urgent need. And we're just going to be doing a lot of phone triage and things like that just to help with social distancing. So COVID-19, hopefully you guys all know, it started in Wuhan, China in December. It was something that they think is a zoonotic disease. So it probably did come potentially because it can cross between some animals. And so they think it probably came from their live market. Why it spread so fast was probably a combination of things. One, that it was starting to be infectious in a small or in a contained area with a large amount of people. The other thing is that for a little while, China was a little bit in denial that that was what was going on. And so they didn't actually step in really quickly to take care of any of it. So there is that. It has now spread worldwide. There are still places that do not have confirmed cases. There's speculation that maybe either they're kind of more isolated places or they're not testing. So for instance, Mexico only has maybe 7 cases, and we think that probably because of how close it is to us, the US, that they're probably just not testing enough. So there is that. As far as things that you need to know, people are asking, is this just another influenza? Should we not panic? I don't think panicking is helping. I think that you can be prepared, but not panic. And so what do I mean by that? I mean that it is right now, because of how it is spread in the US, and it is community transmission, meaning that if I am sick, I can give it to you. Okay. And this is an illness that presents like a cold. Coronaviruses have actually been around a long, long time. It's the second most common cause of a cold here in the United States. But it's just that this is a different strain that none of our bodies have immunity to, and it tends to be a little bit angrier in a sense. So what does that mean? That means that if I am sick, I can transmit it to you. What it looks like in each person kind of depends on how their body is, what their immune response is, and their age, and then kind of what their underlying is. But obviously we've seen offshoots of that. We've seen the young, healthy Chinese doctors that have died from this. So things that you should know. Oh, hey, Jen, thanks for jumping on. Things that you should know. A lot of people will have this very mildly. They're saying maybe up to 70% of the population will have this. We're not so certain if those numbers are true. We're hoping that now that everything is kind of shutting down, that will be contained a little bit better. But most people will probably just have mild symptoms like a cold. Like you have a cold and you're like, man, this cold, it kind of sucks, but it's not terrible. Especially when it comes to our children. We're seeing that the cases in the kids are insanely mild. So a lot of people have been coming to me and say, I think this has been in the US a long time. My kids have been super, super sick. They were like insanely sick, the worst cold ever in January. That was not this, because most of our kids probably will be very mild and maybe the vectors that are spreading it to other people. So if we know that the kids aren't getting sick, why are they closing everything down? There's a couple articles and I can share them and put them like in the recording area, but one of the ones that's really good, and I could probably pull it up if I share my screen, and I don't even know if I know how to do that, is it's basically, if you look at us quarantining from the Spanish flu, there were 2 cities. One was Philadelphia, who decided to still hold this huge parade. And then there was another one that was St. Louis that decided, nope, we're going to shut everything down. We're going to close it all down. When that happened, Philadelphia, by the end of the week after the parade, had 4,500 deaths. And St. Louis had a fraction of that. They still were hit by it. They still had deaths from it, but it was spread out. And so that was something that has a higher death rate, the Spanish flu, than what we're seeing right now. So in that one, 675,000 Americans died. It is not as deadly as that. What we're seeing is that probably the death rate is hotly contested. I think in China, it's close to 2%. They're expecting that it's probably close to that. Interestingly enough, in South Korea, they're the ones that have done the best testing and the most testing, and their death rate is much lower, like 0.5%, I think is what they're coming out. Italy has a higher a higher death rate from this. They're thinking that probably that's because they have a larger percentage of elderly population. Something like 23% of their population is higher. Now, these stats, guys, I've from my memory, so they might not be exactly, but they're thinking that that might be it. And they may not be testing as many people who are actually infected in Italy. So the death rate may not be exactly that, but they're saying it's closer to 5%. Our highest risk for death in this, guys, is actually anyone over 65. So that is where all this social distancing and quarantine and everything comes in. Because here's the thing. So my family, we were going to go on the Beachbody trip. We chose to cancel sooner than they had decided to cancel because we were afraid of being quarantined away from my kids. That's a big fear of mine, is being separated from my kids. I'm not afraid of being sick. I'm afraid of being separated from my kids. And I was worried about being stuck out of the United States without somebody else here. So we decided to cancel before Beachbody made that decision. That being said, though, my parents were like, I think we will still come out and hang out with your kids, and you guys can go hang out on the town or whatever, have date night. But here's the thing. My parents are 65. Now, granted, my parents are healthy 65-year-olds. They have no heart disease. They have no high blood pressure. They have no diabetes. They have no lung disease. They are the people that are at the gym, hanging out, eating healthy, have been for all their life. They're healthy lates. My mom is still working. My dad is still working. Everybody's just great. They help with my family, my sister's kids all the time. I told them that I don't think that they should come out. Why? Because with me being at the front lines, it's likely that I could get a mild illness. I could pass that to my children who would have even milder symptoms than I would. And then my parents come out and they're exposed to it. And now the death rate above 65 is 15%. So they are a higher risk of dying from this disease, having pneumonia, having complications, those type of things. It's not worth the risk for them to come out. I have girlfriends that are like, oh, we're stuck for spring break. I think I'll go to my mom's. Don't do it. Don't go to mom's. Don't go to grandma's. Keep your distance. Stay away from them. So that's the biggest things that I'm hearing. And that's why the other thing, I wish I knew how to share my screen because I would show you the social distancing thing. Maybe I need to look up here. There's this idea of social distancing helping flatten the curve. And the basic idea of it is if we all get sick all at once, maybe start share. Does that work? Yeah, maybe it does. If we all get sick all at once, you guys, we do not have the resources. Maybe not. So the basically thing is that there's a big, huge curve that comes up like this. If we all get sick all at once, if we space this out and stay quarantined and everything, then we may still, the same numbers could be sick. The area under the curve is the same, but that is slowly as a slow curve like this. Okay. And what happens is that makes it so that healthcare providers can actually do things for it. So for instance, we've been testing for COVID-19 in my clinic. There is strict criteria in the state of Colorado. Now this varies by state by state. So if people get sick and you think you may have COVID-19, call your doctor and ask them about it. If you just have a mild cold and you're feeling fine, probably you should just chill out and take your cold medicine and stay at home for the next 14 days. And maybe not call your doctor unless the transmission is pretty low in your state, so that it depends on what their testing is. In the state of Colorado, currently we have 77 cases. We have done 600 tests. So we have a little bit over 10% of the people we've tested have been positive. And we are overrun with people who want tests and need tests, and we do not have enough tests for them. So we've had drive-through state testing that lasted for maybe, I don't know, Jen, if you heard, but 3 hours potentially. They had to close it, and then they had to close it the second day because they were so overrun with people coming up to be tested, and they had to have a doctor's note to run the test, and they still were overrun. So too many people coming in. At my clinic yesterday, we were going to be open Friday and Saturday and seeing these patients, and we had 8 total tests. We have 8 physicians, 8 providers in our office. So or 7 providers. So we're a busy office, and we only had 8 that we could run. And then once we've ordered more, there's not more to be had. That being said, so I said that my clinic is doing a isolated clinic. So everybody has to go to one central location. Oh, good, Jen. Thanks for pulling it up. She said, here's the graph for social distancing so people can do that. So click on that for later because that's a really good one. My clinic is going to send all of our sick people to one centralized location, and then they're going to be screened over the phone, and then there's drive-through testing or there's in-person testing like being seen in the office. That clinic serves 150 physicians, so that's a lot of patients that we're taking care of, and we have 350 tests. That is it. and we don't know when we're going to get more. So I've had people ask me like, hey, does it make sense for us all to get tested if we think that we have this so that we can monitor the spread? Yeah, in a perfect world, I would love that. That would be so fantastic. It would encourage people to stay home, because my fear is that people are going to have a cough or a cold and say, this couldn't possibly be it. It's not that bad. Or I really, really need to go get this thing I really need my Starbucks. You don't understand. My kids are driving me crazy. I have to get my Starbucks. And they go and they run into somebody else who then gets sick, who gets the other person sick. And that's how it spreads. So just being really thoughtful, mindful. Some of the ideas that Starbucks is doing, where they say you can do drive-through only, or just come in and pick up your coffee and then leave, but not do this centralized seating. I think that's good. I do think it's good that we are doing, maybe even if some of the restaurants are still open, and Jen can speak to this too, but if the restaurants are still open, doing takeout so that you can support the restaurant, but not staying in the restaurant. At the moment, we think that probably you have to be within 6 feet of somebody who is infected for about 20 minutes. But we don't know that that's exactly all of it, but that's what we know for certain. So, or for right now, all of this data is constantly moving. Other people have asked about the comparison between influenza and this. It's a little bit apples and oranges. And so the very beginning of this, I was like, especially when it's still in China, I was not panicked about this COVID-19. I think it was no issues. And I was like, listen, there's still more risk from influenza. And when it comes to young, healthy people, you probably still have more risk from influenza. We'd have to run the numbers. But so influenza in the United States, we have had 36 million cases, 370,000 hospitalizations, and 22,000 deaths, including 144 kid deaths. Okay, that's in the United States. When we look at the numbers from COVID-19 worldwide, we're at 132,000 cases and just under 5,000 deaths. The difference is, when it looks at absolute numbers, influenza is worse. But the death rate on influenza is 0.1%, which is why nothing is closing down from influenza. And also, we are a little lackadaisical about influenza, and we do shed virus before you have a positive test for influenza. And so some people just don't know they're sick, and then that's how it continues to spread. It's conflicting factors in the most recent studies on whether or not we think that you can shed virus with COVID-19 before you have symptoms. Some people say no, not before you have symptoms, but there can be asymptomatic transmission. So I think that's like a quick down and dirty. Hey, Nicole. I don't know if you guys want to ask questions, thoughts that you want to say. If Jen, you want to pop on and say what you want to say about it.
Sure, that was pretty thorough. I think, we're in a national state of emergency now, and different states and even towns and counties are determining states of emergency. I know in Colorado, we're in a state of emergency, but that doesn't necessarily impact my county and my town until my community declares such. But what all that means is, if you know people who are losing jobs because businesses are closing down, really it's the service industry, but it could be anybody, self-employed folks that have, or small businesses. I'm really worried about our small businesses. There's a ton of resources out there because of the national and depending on the statewide emergencies. So the Department of Labor can now require, like in the state of Colorado, now requires 4 days sick paid time off for any employer, so an employee can go get tested for COVID. That's regardless of if sick pay is something that they offer, period, for seasonal, part-time, et cetera. Like they're requiring it. For Medicaid and food stamps and things like that, also, usually it's based on a monthly income. Now, because of the state of emergency that we're in, it begins like now. As soon as you lose your job, you can qualify for Medicaid, you can qualify for food stamps, you can qualify for, it's called this temporary assistance for needy families. It's the worst name in the whole wide world, but basically for anybody with a child or a pregnant person who makes under $75,000, they can have some income replaced. So there's resources out there for folks. share that, because people are freaking out about that. And I think that that's something really important to pay attention to support the social isolation.
Perfect. Thanks, Jen. That's perfect. We were talking earlier, Christine was talking about where's good places to get information, because I think that's where you're really scary. Couple things. Vitamin C actually hasn't been super helpful for preventing colds. They've actually debunked that myth. Vitamin C is probably not what you need. Maybe zinc is helpful, but we don't know. Some of the people that are out there pushing, I saw somebody say oregano oil with essential oils. My mind, like it exploded. There's nothing that says that essential oils is going to prevent you from this. So there's not really great ways to boost your immune system except for the things that we already do. So one thing would be shut off the stupid COVID-19 news feed and go to bed. That's a great way to boost your immune system, you guys. Get good exercise, eat good foods. Alana Molstein actually posted out some really good, like, if you're thinking about need to be quarantined for 2 weeks, what are some good things? Like picking up cabbages, that never goes bad. Picking up spaghetti squash. And then like Jen was saying, maybe there's some small businesses around that'll still do delivery. I've seen some businesses that are waiving, their delivery fee because they just want your business. And so having them deliver to your house or supporting things that way. So thinking through some of those, but eating healthy, drinking water, getting rest, all of those things are still going to be really helpful for boosting your immune system. Things that are probably not helpful is like the essential oil stuff. Vitamin C probably isn't helpful. So there's not a whole heck of a lot of like boosting your immune system. Your immune system is what it is. I've had people come in telling me that they think they're high risk because they get bronchitis every year or they get pneumonia every year, but these are like 30-year-old, 40-year-old people. They're probably not actually immune compromised. The people that we need to be thinking about immune compromised is my girlfriend down the street who is on medication for rheumatoid arthritis, okay? The other guy that we've been thinking is our family and thinking about, okay, now that you guys the schools are shut down, who is it that maybe we should for sure distance ourselves through? It's not going to be helpful if you guys all have 15 play dates and you have 25 people all in this room together. Okay, that's not helpful. So maybe smaller play dates. But we talked about that kid down the street, that his mom has RA. We probably shouldn't be close to him at all. Our neighbor across the street who's 65 and has asthma, we should not spend close to time to him. We should reach out. We should text. We should ask them what they need and see if we can deliver things to their house, but we should not be close to them. And so being thoughtful about that, but good places to find information. I live on the CDC website. I live on WHO website. Some of the gals at my office are calling it the WHO. It's not the WHO, you guys, it's the WHO. Sound intelligent when you say it. State health department. So your state is going to have a different reaction to others. And so I found this the other day when I was saying, we don't have enough testing supplies, don't call and get tested. If you have really mild symptoms, just stay home. And I got a backlash from somebody from Minnesota. Well, Minnesota has, I think, 14 cases. And so she's like, well, here they're saying everyone should get tested. Great. Well, Minnesota might have those resources. They've run about the same tests as Colorado, and they have 14 cases. In Colorado, we have 77 and have run about 600 tests. So we don't have the testing supplies for it. My dad actually came down with symptoms this morning. He just came off of a cruise ship, and he's 65 and started to have some symptoms this morning, a cough, a low-grade fever, and he's like, is this or is it something else? It might be. He called his place, so he's in Nebraska, and they said, we are not doing testing until you have been sick for 24 hours. We don't want to waste a test on someone who gets sick or gets better after 24 hours. That might be a 24-hour drug. So your state might do something different about that. There you go. Jen says that in Colorado, we started with something like 900. Well, then I feel pretty good that our clinic has 350. It might be that's what the state has, because I know we also have 2 private testing facilities are running tests now, Quest and LabCorp. And so I think that we're sending some of ours that way as well. And they're not, Quest and LabCorp, these private companies, are doing the testing for free. So those are the things. So I think Jen's being thoughtful about how we help and support our community is huge, and I think that's helpful. I also, it's a personal opinion, so you can just take it as it is. I think posting silly quirks about like, I'm healthy, I'm going to be fine, that's not helpful. Or I don't think that saying silly things like, my gym has no corona, how about you, isn't helpful. But basically saying like, have you guys thought about maybe staying out of your gyms? If you need help, I'm here for you. Okay, so that's a little bit more sensitive in the way that you're speaking about it rather than being snarky about it, because there's people who are really living in fear. So
I had a quick question too about like cleaning. That sounds like kind of odd, but just noticed like everyone's buying out all the bleach, and I'm like, I'm sorry, I use bleach very little in our house. I use it, if at all, in our whites in our laundry.
Yeah.
I use like Dawn soap and white distilled vinegar as my main cleaning product. And so I don't know, is that like a big thing? Like we should start using bleach in our houses? I mean, do you know what I mean? Like what else will kill this virus other than sunlight? I know we can't just stand in sunlight, it will kill it.
Right.
But I mean,
so I don't actually think vinegar is strong enough. I think what they've seen, Jen's shaking her head no as well. Vinegar is not strong enough. You do need something stronger than that. Lysol does clean it. So if you don't want to bleach things like that are color sensitive, Lysol is active against coronavirus. Bleach wipes, and really high alcohol, but it has to be for a long period of time, right, Jen? Yeah, she's saying yeah. So you kind of have to really scrub it down. But just don't discount the fact, okay, the other thing is antibacterial soap versus bacterial soap versus hand sanitizer. Don't discount the fact that this action with water and really spending time probably does a great job. Yes, you should probably use soap, but this action is also helpful. It's kind of like the idea of brushing your teeth without toothpaste is probably still great, right? So that action underwater is still probably helpful. So if you're using something, vinegar is probably not going to cut it, but if you're using something like alcohol to help wash things down, you probably need to keep rubbing over it a little bit more. But yeah, bleach wipes are going to be better. People are actually recommending that as long as it's not something that's color sensitive, making like a bleach spray would be really great. So doing a certain percentage, you could Google that, a certain percentage of water, a certain percentage of bleach, and then spray it and then wipe it down. And that's probably going to be even better than your vinegar at this point. Yeah.
I just posted a link too for the CDC, and like Cassie said, I've lived on that site, and it's such a great resource because it really walks through, like I'm a business, I run a nonprofit, so how to prepare my nonprofit, how to prepare the community, how to prepare my home, how to recognize the symptoms and what's the difference between that and the common cold and the flu, and the cleaning, like all that stuff. So it's actually a really great site.
Other questions?
Awesome. Do you all mind is that what you're posting in the chat? Can you also, those links, can you put them in the post on the group? Just because I'm on my phone, so I'm not clicking on the links. So that'd be fun. Thank you.
Yeah. Anybody else? Nicole, you have any questions? And I'll post this in the team page, and then if people want to ask questions underneath it, I'm totally open to it. My spring break trip just got canceled. We were still going to go to the mountains, and we were in our own secluded VRBO. We were not in the hotels. Just so that you think about how we were doing it, we were not going to ride any ski lifts with any other individuals. And we have gloves and masks because you're skiing, and then neck gaiters, which is not the same. Let's go over masks really quick so that we have that too. But the neck gaiter is not the same as a mask, but we were just there's a balance. I think you have to have a big balance between not living in fear, but also being really socially responsible and watching your community. So we were supposed to leave today. Our VRBO actually canceled on us. They said that their entire staff is under quarantine and they can't keep their building open. I'm not even certain if I believe her, but it's fine. We weren't going to Aspen. Aspen has the biggest outbreak. They had Australians descend, and I think they had 9 or 10 people that were Australian that all came down positive when they came for their ski vacation, unfortunately. So I actually think that part of the reason Colorado has higher numbers probably is because we are a destination place that people want to go. And so people are coming from Seattle, people coming from all over the country and the world to come ski here. I think that's why we have more of a transmission here.
I think a third of our cases are travelers.
Yep. Yeah, exactly. So So yeah, so I got canceled. My clinic actually is limiting how much patients we're going to see. So I'm around if you need to ask questions, if you just need to say like, hey, can I have a breather about something? If you guys need to for a minute, like panic and like cry and rally and do all those things. My dad texted me this morning and I literally went up to my husband and I said, I am not coming to you as a medical professional. I realize that none of this is logical. I need to cry about this for a minute. Like I need to lose my mind and then I can pull it back together and move on. And that is okay. Let's go to masks really quick. Wearing a mask when you are healthy in the community is not going to help you. It's not going to help you. And the reason why, and there's another one, I'll try to find that graphic too, is that, sorry, I'm trying to figure out. So I'm also not on call, but the guy who is on call, somehow they linked my phone instead of his phone. And so now I'm getting the pages and it's kind of a mess. So the whole world is falling apart. Just kidding. So anyway, so the masks, wearing a mask in public when you are healthy is not going to help you. Why? Because the people who are sick around you are sneezing on anything. They're sneezing on my coffee cup. They're sneezing on this disgusting device that we can't keep out of our hands. They're coughing on this. They have all of that. So you think that you're protecting your face and everything from droplets coming at you, and then you touch this and then you eat. That's how you're getting sick. Or you touch this and then you wipe your nose. That's how you're getting sick. You're touching everything, and we all touch our faces all the time. Masks are not going to protect you. Leave them for the medical professionals. We really do need them, you guys. We are like, I have a nurse or a student with me this month who still hasn't had an N95 mask fitting, and so she can't go in if anyone we are suspecting is there, because then she would be exposed. So the regular surgical masks, if somebody is sick and you happen to have a mask around and the sick person is there, you should probably, it's okay to wear a mask, but being healthy in the out in the public does not help to wear a mask. The masks that probably are the most helpful against this is the N95. Don't try to find them. Don't try to buy them. The medical professionals can't find enough. We can't see the patients we need to because of it. So you need to just calm the junk down, wash your hands, and let us try to protect ourselves so that we can continue, because we are having I saw somebody last night that they had to transfer a patient because the two doctors in the hospital that could do the procedure that they needed to have on the patient, a life-preserving procedure, were quarantined because they've been exposed or they were sick. And so they couldn't help the person. So that's when we all have to get together and help out. So as much as it's like, I need to protect myself, you need to protect your community. And so us young, healthy people need to do the best that we can with that. If you get symptoms, feel free to call your doc or call the State Department if there's a hotline that they have. If you are worried about that, if you're feeling 100% fine, just hunker down, guys. We're going to hunker down for a while. That's why we have good online workouts. If you are worried or you think you might be high risk or you're getting severe symptoms, because young, healthy people are getting them too, call your doctor first. They may not have testing. They may have a better place for you to go to. Calling the ER ahead and saying, I think that this, I'm having shortness of breath, I'm having fever. Should I come to you, or is there a different ER in the area that I should go to? Are they trying to do that? So calling ahead is going to be huge, because they may not have the resources, and then you're driving around exposing a ton of people while you try to figure out where to go. So, other thoughts?
This is just random, but I know you said that most people that are getting it are higher to get it are 65 and above, and then it's more like adult, and that kids have mild symptoms of it. Have there been, do we know, any deaths from younger?
There's zero deaths in anyone 10 and under, even in China. They did get sick. They did not die.
That's so interesting. I'm wondering how, I get very technical. Like, I like to see the graphs, like what is it attaching to our system and our adult bodies that is breaking it, anyways. I know it's
something, we don't know exactly why but kids seem to be mostly protected from this. The death rate of anyone who's healthy and young under 40 is only like 0.2, even in China and some other places. So young people can still get sick. Let's make that clear. They can still get sick, but they're not as high risk for complications. Does it happen? Yes, but it's not as high a risk. Yeah.
Thank you.
Yeah. Jen, you said you were about to say something. Okay.
Sorry, I was posting something for Nicole.
Oh, perfect.
Yeah, I have somewhat educated hypotheses on that, why children aren't having deaths and have milder symptoms. I don't necessarily want to share that because it's a hypothesis, right? But if you look at disease epidemiology and etiology and what that means, I mean, for me, it makes so much sense that the people that are getting most impacted and dying from this, because as you get older, your immune system is less, right? You have all these chronic diseases that compromise your immune system. So, until we know more, I think we just do the social isolation. I think it's really important.
Totally. The interesting thing was I was looking at the H1N1 and the highest death rate was actually under 65 for H1N1. So it's just interesting.
Yeah, it's usually even for flu, right? It's like 60 and over, 65 and older, and young children. So it's kind of a paradigm shift thinking about that, because even, like you said, 0 deaths under the age of 10, and usually it's like 2 and under are really highly susceptible too. But there's some level of something that isn't impacting the kids, whether it's whatever it is.
Right. Thanks for popping on, you guys. I so appreciate it. I'll post this and then we'll start with posting some links. I feel like we should stop the video and then we'll copy all your links, Jen, and then just move them, copy and paste.
Yeah, I already did that all except for the one that I just did. I posted under the Zoom.
Perfect. Sounds good. Well, thanks guys. I appreciate you popping on. Have a good day. Stay safe.
Thank you so much. Okay, bye.
Bye.